Depression is one of the most common and destructive health problems we face today. But what is the difference between feeling depressed and depression being a clinical diagnosis? So that's what we're going to explore today on our episode. I'm Pat Fehling. Stick around. We're going to delve into this topic so that you can understand a little bit more about what to look for if you might be dealing with a period of clinical depression yourself. So when we're analyzing depression from a clinical perspective, we will use the term of a depressive episode. And this is important terminology, but because it does imply that it is time limited, it will not go on forever. And it also means that it is all encompassing for that stretch of time. We also care about this concept of a depressive episode because people may have something called recurrent depression. That basically means that they may have one or more episodes over the course of their life. Feeling depressed is not a health problem. I think that's important to know. Feeling depressed is part of humanity. So what's the difference between just an emotion or just feeling depressed compared to something that we might approach from a health perspective? And that's what we're really talking about today, is how clinical depression is a health problem and what are the symptoms we would pay attention to in terms of making this diagnosis. It's important to know that for somebody to have clinical depression, the symptoms have to be present for at least 2 weeks. Nobody can have a diagnosis of clinical depression just within a couple days. That's an important way to start in looking at some of this topic. And it also has to involve the majority of the time over those 2 weeks. So you do not have to have a depressed mood 24/7, but it has to be by far the bulk of your time stretch over those 2 weeks. We start by looking at sleep. Sleep is a very big symptom with depression, and it is incredibly common. It can come in two overall forms, which is insomnia, which is that you're not sleeping enough, but it could also come as what we call hypersomnia, and that's where you might be sleeping 12 or 14 hours out of a day. The distinction between the insomnia and hypersomnia is very important for me as a clinician, because if I'm talking about a certain medication approach, I might use a different med for somebody who has insomnia compared to somebody who has hypersomnia. Loss of interest is a very big symptom for depression, and sometimes it can be the telltale symptom for somebody who does not have the classic tearfulness and low mood. They might be more disengaged or not present in their life. And so that also is clinical depression as well. So it's important to pay attention to that. Are there things you used to care about, hobbies, spending time with people, that for whatever reason these days you are not engaged, you're not interested in that? That could be clinical depression. We focus a lot on the voice inside of you and what you say to yourself. So if you're highly self-critical, beating yourself up, we would call this excessive guilt. That's a very big symptom for depression. And from a historical context, people over the years have described depression a little bit in the realm of anger, the concept of anger turned inward. So the person or the mind is beating itself up. And I think that can be descriptive for what we call this excessive guilt symptom. Fatigue is a very big problem for people who have depression. And for a lot of people, the low energy and fatigue can be a source of a lot of the disability of depression. It's very difficult to be taking care of your family if you're chronically fatigued. It's very difficult to get to work and engage at work. So low energy really matters. Sometimes people can be very foggy when they're depressed. They can have concentration problems. They can feel like they're not present. This might play out in the form of, well, if you try to read a novel that you're working on and you can't seem to get through the pages. So you will have to repeat a page over and over and over again. You don't seem to be getting anywhere. Or sometimes people are driving home and they're forgetting their turn for their neighborhood and they're just really not there. If you notice things like that, that can be a very common symptom of depression. Appetite really matters for this. Usually it is loss of appetite and sometimes losing weight, but it can go the other way as well. Sometimes people will overeat where they'll actually gain weight during a period of time where they're clinically depressed. Physical symptoms are another sign. The technical term for this is called psychomotor. So we would call it either psychomotor agitation or psychomotor retardation. So agitation is a restlessness and a movement, like they cannot sit still and they're not comfortable in their skin. And then the psychomotor slowing would even to the point of where people are speaking very slowly, walking slowly. The most extreme of this is something that's called catatonia. Catatonia is where there's actually a chemical imbalance in the brain where the brain and the body are starting to kind of lock down, and which is actually a medical emergency. Finally, we pay attention to themes of suicide. There are many people every year who are clinically depressed who will make a suicide attempt or take their own life. So if this is something that you are dealing with, talk to your doctor, talk to your family or other healthcare providers. I think it's also important to know that sometimes people who have very severe depression, including suicidal themes, may need to spend some time in a hospital setting to be very safe. And I think that's a good message for anybody who might be watching this video series. If you are really unsafe and really need acute support now, you can call 911. You can reach out to a crisis line. You can try to achieve safety. So I think safety is the most important ingredient for people who have very significant depression. I hope you found this video informative and useful in terms of the way a psychiatrist may approach clinical depression, how we look at the symptoms on a deeper level. And it's important to know that you need to have these symptoms for it to be a clinical condition such that then we would treat it using healthcare algorithms. And the healthcare algorithms might involve medication approaches or in-depth psychotherapy approaches. But to make the diagnosis, it's going to require a constellation of some of these things at the same time. I'm Pat Fehling. Thank you so much, guys.